times. No, sometimes we just weak and say, I'm tired. Today I feel weak. It's okay.
But mental health is an issue of trying to balance life.
You're taking antidepressant medication, it's a big secret.
Age of onset for many mental illnesses is right in the 20s.
Greetings, this is Dr. Triple O. Today's episode is Mental Health Table Talk. The World Health Organization defines health as a balance of mental, social, and physical health. This is also defined as health triangle. A good balance in the three areas is essential for healthy lifestyle. And I'd like to thank Fantastic Wellness Center for hosting us today. By the way, wear your green this month. Green to support mental health awareness. Green is the official color this month for mental health awareness. Green represents renewal, hope, and vitality. To help foster this important discussion, I have four great distinguished guests here today. I would like to give a quick welcome to everyone and a little background on each one of them. They all have great experiences and they've done so much in the community, so there's no way I can talk about everything they've done. But I'll give you a quick summary of each one of them so you can understand the breadth of experience they have. To my right, Lorraine Voltaire. I've known her for quite a few years now. She's a nurse practitioner. She's also the CEO of Optima Tea, as you can see in front of us here. She also hosts her own podcast. What's it called?
Health and Wellness Corner with Lorraine.
Lorraine. So you can always check her out. She's also been around doing different things outside of those things we talked about, which is, I don't know how she finds time to do those things. And next to Lorraine is Salicia Smith Gordon Esquire. She's the founder, managing attorney of the law office of Salicia Smith Gordon PA. She has been recognized as a lawyer of distinction, compilation of works as a strategist, litigator, advocate, and community servant. I've been recognized professionally and civically with several honors and awards. She received a Bachelor of Science in Pharmacy from Florida A&M University and a law degree from Florida State University. Thank you for joining us.
Thank you.
And to my immediate left is Teresa Jones. I've known her for several years in the hospital and outside the hospital. She's an administrator at Fantastic Wellness Center. By the way, thank you for hosting us today.
My pleasure.
She received a Bachelor of Science in Nursing from Long Island University in New York and Master of Science in Health Administration from Central Michigan University. She has over 35 years of nurse leadership experience in New York and Florida. Thank you for joining us.
Pleasure.
And last but not the least, Dr. Maybank. She came all the way from New York to join us today. And that's quite impressive on the short notice. Dr. Maybank is the Vice Chancellor of Student Affairs for the City University of New York. Prior to that, she served as the Vice President and Associate Provost for Student Affairs and Services at Michigan State University. Dr. Maybank is a member of several professional associations and serves on several boards. She holds a doctorate degree in counseling psychology from Michigan State University. Thank you all for joining me today. Today, the topic is very dear to me, mental health. I don't think we talk much about it. As a physician, we tend to speak more about physical health, and we ignore the mental health. So I want each one of you to share your personal experience and to, have a conversation and maybe help other folks out there who are listening to us today. But before we go into this, I was thinking about this last night. There are stereotypes of mental health. But before we get into that, I want to ask each one of you, what are the misconceptions, stereotypes about your profession? We'll start with you, Alicia.
About my profession?
Yes.
Well, in the profession of law, I believe that the stereotype of fear I would say, a fear of admitting that you have a mental health issue, which denotes a fear of weakness, that someone thinks that you're weak. For the practice of law, interestingly enough, once you take the bar exam, people think, oh, you passed it, and you get in, and you're all of a sudden a lawyer. No, it doesn't quite happen that way, because you have to be able to show that you are mentally fit in order to practice law. And so there are questions about mental health and disorders. There's some that you do have to disclose, and in fact, in that disclosure, they will submit you to an examination at times to determine whether or not you are indeed fit. Now, I believe there's some possible changes on the horizon. The American Bar Association has tried to deal with this in a very strategic way, because it is quite invasive. Whatever your mental health issues are, or mental diseases, and I believe the doctor will talk about it, those completely two different things, mental health versus mental disease. It's opening up wounds, it's very invasive, in terms of emotionally. I've not had that experience, but I can only imagine that. So in my profession, we start off with that particular issue of disclosure, of fitness and character to practice law. And then once you become a lawyer, the stresses of being a lawyer, we know that lawyers are number 4 in the suicide rate. We're in the top 10. And if you're a solo practitioner in your own practice, the rate is even higher, because now you factor in mental health, alcoholism, and a whole nother wide variety. The Florida Bar Association recognizes the troubles and has a committee especially launched for lawyers, and even a 24-hour helpline for treatment, because we have mental health issues, diseases, doctor, you'll correct me how I'm saying this, but challenges that take a different range of treatments or latitudes that may impact not only you personally, but affect your patients and affect your practice, and you don't want to lose your license. And so yes, it does hit us home terribly in the Florida bar ring, and then it hits you when you're actually practicing, depending upon the atmosphere that you're practicing in. For many people who are lawyers, especially black women, the ABA, which is the American Bar Association, did a study. And interestingly enough, when we think about studies, medical studies or Harvard studies, you know that you have a quantitative amount of people in order to perform the study with a defined amount of time. This was more difficult because you have so few black women lawyers, and our history of being able to be lawyers is so short as compared to others. Think about that. And in Florida at FSU, the earliest black graduate we have is 1972. That was the first. Yeah. So when you think about that, how many, when you have a class, or class sizes are increasing, I think this year is 22 or 25, but typically it's 7, 9. When you think about that, you don't have a huge sample segment to draw from. But that they could draw from, they realized that 70% of the black women lawyers were considering leaving the profession of law. And when you're only 2% of the total, that is monumental.
Yeah, we'll dwell more on that topic. That's very interesting. Lorraine?
Well, mental health for us as a healthcare provider, I'm a nurse practitioner, I'm also an entrepreneur. It's different for me because in my line of practice, I have to put a face with the physical aspect of health as well as the mental aspect of health. So we have to be strong in order to take care of those who are weak. So we have to put that face where, okay, I'm strong, I can help you. Because we don't want to have that stigma, not only for our patient, but also for our co-workers. Because physician burnout, healthcare provider burnout is really high. That level is so high that a lot of people don't understand how many of us practitioners are leaving the profession. Burnout because of stress, and I believe we are taking care of others, but we forget about ourselves. So it's a totally different aspect, but I will go back and dwell more about it, and I will let it to you, Dr. O, to continue with the ladies because I have more to share.
Yeah. I think there are two things you said that's very striking. Two words you said. One is strong and weak. And I think I'd like to address that later on because that's part of the problem we have. And I'm sure we're going to talk more about it later on. When you perceive yourself as strong, what you're basically saying is there's no weakness within you. But we all have weaknesses, we have strength. So if you already setting yourself up for failure by saying I'm strong, right? I'm human. The same person that we consider weak may be weak at something but strong at other things. So I think that's one of the things we do as parents and as professionals. We want to be strong at all times. No, sometimes we just weak and say, I'm tired. Today I feel weak. It's okay. And so we'll talk more about that later on. But I want to see what you guys have to say in terms of stereotypes.
With Lorraine, I agree with a lot of things that you say as a nurse, and I've been in nursing leadership for over 30 plus years. And as a leader, you don't want your staff or a patient to see that something is wrong. So you walk around with a lovely painted smile, you take care of everybody, you take care of the patient, the staff, your coworkers. There are a lot of pressures in working for a corporation, in healthcare. You have your leaders, which in some communities we call the C team, or your regulatory agencies that is dictating what should be done. And you have to abide by that because your hospital leaders expect that to be done, whether or not it benefits the patient or the staff or your colleagues. Is things that must be done. So you have to find a way to get these things done, painted smile on your face. You leave work and you go home and you're stressed out. It's unbelievable with the things that you need to accomplish that you know sometimes it's not beneficial to a patient or it's not beneficial to your staff.
All right, Dr. Maybank, maybe you can summarize and tell us what this all means.
Oh, I don't know about that. Because that's a part of the stigma. The assumption is once you provide that label of psychologist, you are reading my mind, you know everything about me. What are you thinking about me? Are you analyzing me in the moment? You know, and that's a part of what happens very often, that people hold the expectation that you have an understanding of who they are, what they're doing, and everything that they're thinking. Not mind reader, just trained to understand behavior. And so I think that that's a little different. But as we think about Mental Health Awareness Month, I think it's important to understand mental health is something we all take into consideration because mental health is about our psychological and our emotional well-being. Mental illness is when those things become disordered in some way. Whether we're talking about bipolar issues or we're talking about eating disorders or something as extreme as schizophrenia, that is when it becomes disordered in some way and impacts our thinking, our feeling, our perspective, and our behavior. And that's when we're talking about mental illness at that point because something is out of line. And so whenever I think about people trying to figure out what they do in the context of their mental health, it is a matter of embracing our humanity, as you said. We are all human. We all have to think about how we relate one to another and the impact we have on each other as we do that. Because those are the things that reinforce and support us and empower us, even in those spaces where we may be weaker, and help to sustain us in those spaces where we may be stronger. So it's an opportunity for us to experience other people's humanity and maintain the dignity of others as well.
Great. And I love what you said about when people see you as a psychologist, they think you can read their mind. And I can share with you my experience as an infectious disease doctor. When I go in the room and tell someone I'm an infectious disease specialist, sometimes people go, oh my God, why do I need you? Because in their mind, that specialty is linked to something bad, such as sexually transmitted disease or Ebola or something crazy. And I said, well, but if you have a urinary tract infection, I treat that. If you have an infection of your skin, I treat that. They go, oh, but is that stereotype, misconception that people have? And they have that about every specialties and every disease process. So I think that sometimes expectation leads to disappointment. Rather than just expect or think you understand what that person is about, you should try to learn about it. And that's very important. So moving along, the next question is, why is mental health important in our overall health? In terms, from you mentioned it, Alicia, about what a lot of our Chinese are going through. How are they, putting mental health, as a factor in their overall health?
I think that more recently, in the more recent years, we are trying to destigmatize the mental health as we are trying to destigmatize the strong black woman. Okay? And I can only speak from a black woman's standpoint. But what I can tell you, though, is I think that historically in our culture, mental health is seen as something for crazy Uncle somebody. Or if you have issues, you pray about it and you'll get through it. Or you just don't, you'll get there some kind of way. Or why are you sad? And it's not necessarily about being sad. It is about trying to juggle so many well, not a doctor, but it is about trying to juggle so many things. But it's also, if there is a chemical imbalance, just like we go to a cardiologist, infectious disease, primary care, a dermatologist, any other ologist or surgeons, we're going for a treatment. For some reason, the psychologist or psychiatrist wing of the medical profession seems to be one that people that our people in our race want to avoid. Now, and I say that specifically because, see, in other races, if you don't have a psychiatrist or a psychologist, something's wrong with you. It's in our culture, but in other cultures, that's the norm. So that you can have someone to talk with, that you're paying to talk to, who has experience to know how to listen to what your issues are, and to help you navigate them by helping to navigate your responses to them. In our community, if you don't have that person to talk with I'm not saying the people you're talking to aren't caring, but heck, if they don't know any more than you know, then they really can't help you out. Okay, they can be there as a sounding board, but in the end, it's not so helpful. I do believe that when I see mental health amongst my friends. I say my mental health, I shouldn't say mental health versus mental disease, but mental health is an issue of trying to balance life. And I see it through myself, I see it through my friends, my families, my colleagues, and a lot through my clients, who I only handle traumatic and catastrophic injury cases. And that is a change to their normal existence, and life is something that they were not responsible for in the first place. And so it's a compounding of issues on top of what they had pre-accident. So pre-accident, we were all stressed. We're sitting here. Now you add more on top, which comes with injuries, which comes with finances of medical care, hospital, surgeries, anxieties of necessary surgeries, everything else. So on top of that, God forbid, you've got somebody who all of a sudden needs to come and stay at your home. So now you're a caretaker, you're taking care of yourself, you're trying to take care of your business or your work, and you may be working in an environment, even though we're lawyers, you're working in an environment for which you're not necessarily welcomed. I mean, someone said, you can be invited to the dance, invited to the prom, that doesn't mean that you get asked to dance. So that's real. You can be there. I see it if I'm sitting on a board, and often I am the only one of any color, and sometimes the only woman. It's that way in court as well sometimes, the only woman and the only black. So you have to know how to navigate that, your coping skills. And if you are not in a welcoming environment or have a subsection outside of your everyday existence to feed your soul so that you can function, not just survive, but thrive, I think it leads to other troubles that are more difficult to conquer. And so one of the organizations I'm a member of with the bar is the Cherie Davis Cunningham Black Women Lawyers Association. I am the first vice president. And our president last year was Sandra Powie Moses, who started a mental health care initiative. And she did that, and I think it's wonderful, because we realized that even on a local level, when we're talking about people we interface with every day, your coworkers, your family, your friends, you know when somebody's going through something. You may not know what it is. Well, not everybody, because some people are oblivious. Mm-hmm. And when some people are oblivious and you're in a work environment where you spend most of your waking hours are at work, mm-hmm. and you're surrounding with people who think that after you hear about Breonna Taylor or George Floyd or the gentleman who was just shot 92 times in the car because he didn't have on his seatbelt, we internalize that because we're married mm-hmm. to men who are of color mm-hmm. or to have children, and we internalize those things and those injustices. But yet you're in an environment where you're working where you're supposed to feel like, oh, it doesn't matter. That's not realistic. It's not realistic. And so having a safe place to come and a safe environment and a safe organization that cares and cares about nurturing your thoughts, your feelings, and your fears is one of the things that Cherie Davis Cunningham Black Women Lawyers Association does. And that is a mental health initiative.
Wow.
I'm listening to that, and this is really great because you have that organization that can help people, and you get together. You know, you can get together, you can talk about it. With nursing, and maybe you could identify this. There's really nothing in nursing, or we don't support each other to say we need to have a committee where we talk about mental health or stress right. in the nursing profession. You don't hear of that. Mm-hmm. Mm-hmm. It really doesn't happen mm-hmm. with us as a group of people.
It's true.
Wow.
It is true.
I mean, that's amazing what you said. I think with doctors, same thing. A lot of doctors are not, they don't consider themselves having physical health problems, let alone mental health problems. Mm-hmm. They're less likely to go see their primary care doctor. They take care of everybody, but they don't take care of themselves. Mm-hmm. And that's the problem. Mm-hmm. And I think everything you said is seen across other specialties, other professions, mm-hmm. but they don't have that support system to go to. I was thinking this morning, I'm thinking, there are similarities between attorneys and healthcare providers. So you deal with folks who have physical issues and mental issues, like you said.
Yes. They
get into an accident, they have other issues before and after. We do the same thing. How do we cope ourselves? We take care of these folks, we listen to all the pressures, all the stress they go through, and we internalize that, but we don't have anybody to talk to.
That's right.
And it's not something we want to address. And it just blows my mind that because anytime that word mental comes up, we all shy away from it.
Shy away.
And I think it's really important. I mean, I'm hoping that by doing this, we encourage people to say, you know what, let's talk about it. Yeah. Sometimes I'll walk around and I'll just say something, funny. I'll say to people, how are you doing? They'll go, great. I said, you're really great. Mm-hmm. And they looked at me and said, what's really going on? Mm-hmm. And once I said that to a nurse, and she turned around, looked at me, and said, you really want me to tell you how I feel? I said, yeah, I want to know. She ripped off the wig on her head and goes, I was diagnosed with cancer a few weeks ago. I've been getting chemotherapy. I'm losing my hair. I feel crappy. And there were like 10 people around. Mm-hmm. They all stood there shocked. Mm-hmm. I was shocked. And I go, do you feel better now? She goes, oh, I feel better. And all of a sudden, everybody went around and gave her a hug. This is a person that people thought she had no issues, no problems. She's always smiling. Yeah. But she had issues, but she was kept keeping everything inside of herself.
We call it a mask.
Yeah, that's a mask.
It's a mask. Right. We wear a mask, and on the outside is what you want the world to see. Mm-hmm. But on the inside, it's all that you harbor. It's the junk in the trunk. Right. It's all that you carry with you And that's a lot. That's heavy.
a lot. Yes.
So
If
to
I
make
may,
that,
if I may, I think that a whole number of professions are considered helping professions. And anyone who is coming to someone for help, they want to believe that there is nothing that they need. That's not reasonable. We're all human. We all have experiences. We all respond to the things that happen in our lives. And we have to have that room as well. I appreciate what you were saying about our community, our Black community, where the idea is you're supposed to be able to take care of this. We've been through too much. You need to just figure it out and not show your vulnerability and weakness. And it is not weakness when you know that you are challenged by an experience and you are seeking help. That is an empowering thing to do. And so when you go to a therapist, to have someone help you get over a speed bump in your life. It is not that you are going to be in therapy for the rest of your life, as many of our counterparts in other cultures and contexts may see it. It's a badge of honor. It's like, well, how long have you been in therapy?
Right.
And I'm, okay, how many times have you stepped in and out of therapy? To just get over something, to have someone help you to address an issue, and to have you have the opportunity to share with someone what it is that your experience has been. So just as you said, Dr. O, you ask someone, how are you doing today? And they just automatically, it's just by rote, we just do it. It's almost a reflex. I'm good, I'm fine. And you just keep moving. Are you really? Are you really? And is anyone going to listen when you tell them what really is happening for you? And that's the space we have to create. As we think about Mental Health Awareness Month, think about the opportunities we can create for people to be honest about where they are. And you never know what you may hear that you may be able to say, well, did you think about doing this? Did you think about going to this resource and being able to deal with that issue that you've now shared with me? But I do care. I heard you, and I care. And that can make such a difference in a person's life. I'll tell you something that I do. I ride the subway in New York, since you called me out on the New York thing. I ride the subway, and I try to make sure every morning that I say something positive to at least one person.
Oh, good. That's nice.
So there are those times when we run for the train because we're getting off one and getting on another, and someone will say, hold the door, hold the door. When I get to the door that's been held, I say, thank you, you're my angel today. And the smile that comes across someone's face when that happens is so significant. And it's like you can tell you made a difference in a person's life in that moment.
They were seen.
And they were seen, and that's it. And so if we do more of that, we'll see less of the anger, less of the tension, and more opportunities to connect.
True.
Great, thank you. Can you elaborate a little bit more on the issue of mental health changing over time? Because there is this perception that if you have a mental illness, it's constant, persistent, which is not true. Can you kind of elaborate a little bit more on that?
Yeah, and I'll start with an example. So as you heard, I am an administrator in higher education. And so the age range of people who come into college, is usually as low as 15, 16 for some, and goes up from there, all across the board. The age of onset for many mental illnesses is right in the 20s. And so think about that. So now you've come to college, and something happens that now makes it evident that you have schizophrenia or that you have some psychosis and some psychotic kind of experience, because the age of onset for that mental illness is 25, is 22, is 26, or something like that in terms of what we now know. I had a mother say to me about her son, I sent a perfectly good child to your university and you broke him.
Wow.
And I understand that from the heart of that mother, as though he was fine while he was with me. I sent him over there, and now look at what's going on. And he was having a number of challenges. And so the reality is things may manifest earlier than that, there might be something that gives you some cues. Something's going on here. We need to figure out what's happening. But by the time it's in its full gear in terms of the illness taking effect and having impact and being evident beyond what's happening in your mind, that is when people start to react. And then you're paying attention. And so they just figure you've been this way all along. No. There's something that happens in the chemistry of who we are, in the connections, in the responses, in the behaviors, the feelings, the thoughts, and the perceptions that wind up taking us to that space and causing people to see us differently.
Wow. Wow. Now, the other points I want to make is how common is mental health? So, because we don't understand it or we don't think about it, we don't think it's common. We don't talk about it, we don't know about it, so it's not common. So I want to share some statistics with you guys. 1 in 5 American adults live with a mental illness. 1 in 5. So when you're amongst yourself, your friends, you can think about it. If you have 10 friends sitting with you, maybe 2 of those people may have some mental illness ongoing.
One may be you.
Maybe.
That's
Yeah.
Exactly.
I'm aware of it.
So 1 in 5 youth between the age of 13 and 18, either currently or at some point during their life, have had a serious debilitating mental illness. And 1 in 25 adults, US adults, live with a serious mental illness, such as bipolar disorder, schizophrenia, or major depression. So these are really significant numbers that we don't think about. Because again, if you don't talk about it, it doesn't exist. So I want us to kind of, think about that when we are, walking around, talking to people, so we can pay more attention to what's going on around us. And when I was thinking about mental illnesses, when you think of mental illnesses, what diagnoses come to mind? Can you just give me just a couple of them that come to mind?
Schizophrenia, depression.
Anxiety.
These are
Anxiety is probably the number one.
It's so common.
And there's so
Depression
many
and
different
anxiety.
types of it, and I'll let the doctor talk about it. But I do want to say this, from my experience of dealing with mental health, I mean, I will say I've had a psychologist for many, I believe in the ologists. I do. They're trained to do what they're trained to do. But there's a difference between what you said, mental health, and you said mental illness, different things. I think mental health, we all have mental health because it's just the balance of your social, emotional, and psychological self and well-being. That doesn't mean you have a mental illness that you need treatment for. Mental health, I don't know, you might have something that's happened in your life, that a loss of a parent, a loss of a child, that puts you into a situational kind of depression. Some may stay in it forever, some may not. But there's some diseases and disorders, though, including anxiety or depression, that may last, am I correct? And last a lifetime of different degrees. As a lawyer, really, and it's interesting because some clients, just like I'm sure some patients, you tend to follow, you tend to connect with and see after the treatment kind of thing. I mean, and, the scope. And then there's some clients, really, and we have mental and emotional distress and mental illness, emotional distress and anxiety is part, oftentimes, of the complaint a complaint to sue, because it is indeed real. To see, after the case is over, that person still suffering with a mental health disorder, for instance, fear of driving, because of the impact, the head-to-head collision, or fear of swimming because they've seen a near drowning of a child, a fear of water. Those are actual real. And as a lawyer, I have to as a lawyer, and probably because my first profession was in healthcare, I see it differently. I see the person and try to have them have assistance so that they can navigate all that they've got to deal with. And then on top of that, you've got family members who they may be married or not married, but who don't understand, who say, you know, you should be over this by now.
True.
Or you have a great job. You should be happy. Or what are you sad about?
Wow, yes.
Very
And
true.
it's
That is
not
so
that
true.
they're necessarily sad, it's just that they don't, it's hard to cope when you don't feel welcomed where you are. There's no mentorship, there's no access. You don't feel like you're going to be promoted. No matter what you do, you don't have a way out. So therefore you are traumatized again because it's the recycling of the thought process. Now this is coming from a lawyer. I'm no doctor. I'm just telling you how I see it in my experiences. So I think that sometimes when you're going through it, you say see people. Seeing people and them disclosing what's wrong, like the lady did in the hospital for you, I think is probably very rare for someone to go and disclose it that way. That's a precious moment in time. But just to see and acknowledge someone, you're my angel, or that's a pretty color you have, or you've heard someone speak, just say you rocked that. Something instead of just going, it reinforces their sense of self. It encourages them in a way that perhaps we can't even imagine. It is paying it forward to doing something that we wish somebody would do for us.
Exactly.
Yes.
Yeah, that's great, and I think I'm glad you said that. The reason why I asked that question is that when people think of mental illness, they think of bipolar, schizophrenia, phobia. I'm afraid of heights, but that is something that people say, well, get over it. Well, I can't get over it. When I'm up on a 20-story building and I look down, my legs literally start to shake. So there are a lot of mental illnesses that I know may be severe or maybe people just dismiss, but it's real for me. Anxiety, everything goes, I go over all that. So we need to start paying more attention to what people feel and not just dismiss them. Like you said, people get dismissed a lot. Oh, get over it. Oh, it's nothing.
And that's the common
Yes.
word that people use. Oh, you need to get over it.
Get
You
over
just mentioned
it.
somebody with an accident or afraid of driving. Or you just need to get behind the wheel and do it again. And I think this is part of a culture, the minority culture. We don't identify any mental illness, and everything you should move on, get over it.
Right.
You're afraid to jump over this table. Oh, go ahead and do it.
Yeah.
And again, it's cultural, and I see it. And from the Caribbean culture, you see that a lot in the Caribbean culture, because you're not supposed to show that you have something is going on with you.
Yes.
You're sad, you're depressed. You're not supposed to show that mental illness. You're supposed to be this strong person moving on.
Well, talking about phobia, many years ago I was in New York and I got stuck in the elevator for hours with another lady. At some point she was trying to grab me, and then she think that she's gonna pass out. And we were there for almost an hour. So ever since I have that phobia, so you have the fear of height. I have phobia of, I'm claustrophobic. So one day I went on vacation with my friends and her husband and my partner, all of us, I said, no, I'm not gonna take the elevator because I'm claustrophobic. And she was not happy about it. And the night of whatever we had to do, we went for a funeral during the vacation. And she said to me, well, I don't think I want to travel with you anymore because your fear of the elevator. So now we all have to take the stairs, and this is going to be a trouble now. She started talking about it. And her husband happened to be a physician. And her husband said, we're going to stop this right now. And I'm going to have to disclose certain things right here. She said, okay, go ahead. She said, but this is a phobia that she has. It's a mental type of issue. But you are taking blood pressure medication. You are taking medication for diabetes. Is she going to tell you stop taking your medication for your blood pressure? So as well as much important your physical health is important to you, is her mental health. And then she started crying, and I'm sorry. Yes, of course. So you have to take in consideration that mental health is a major health issue. And like you said, it's not about mental illness, it's about mental well-being. Because when you don't have it, a lot of things don't function. Especially, we have in nursing, because now I'm a nurse practitioner, but in nursing in the past, guess what? I used to call off because I'll call in and say, I'm calling sick. But when I look back, I wasn't sick. I wasn't physically sick. I was mentally sick. I was exhausted because I had a few days that I overworked. Mentally, I was sick.
And again, in our healthcare and nursing, you don't have that resources to help to say, okay, this person is going through a mental health issue, you need to speak to someone.
We don't
Or
have
we
that.
have a support group, let's have that support group, let's sit and talk about it. We really don't have this. Simple thing, our health insurance coverage, again, for the corporate world. You can go to your physician, your PCP, we can come to you, infectious disease, 20 times for the year. Mental health, for that part, you may have 2 visits to a psychiatrist, maybe 4 to a psychologist, and it's limited. The rest of that, if you need more counseling or someone to talk to, that's out of pocket.
Right.
So that prevents some of us from, okay, oh, I'm gonna have to pay X amount of dollars. I'm not gonna go back to the psychologist or the psychiatrist because my insurance doesn't cover it.
Sure.
There are a few things. There are a few things that I think feed this, and so if you think about it, how many of us really have words to talk about how we feel? When you actually get right down to it, our society doesn't embrace our dealing with our emotional well-being because we don't offer a regular vocabulary for talking about how we feel.
Historically, we could not.
And we could not because
so you
it-
had to
yeah.
chuck it up. You had to act like it didn't exist. Even growing up, your about the same grandmother. Hush!
yes.
Don't you cry. Hush! Don't you say anything. Hush!
Mhm.
You know, and it's we've been quieted. We've
Yes.
been trained and historically to be
Yeah.
quiet.
And we've got to make that a different space for the young people in our lives, for our family members to walk in. One of the things that I share with students often is the feelings wheel. And just pull it out, and so it starts kind of right at the core with 6 basic kinds of feelings. So hopefully I can pull them all. So joy, being joyful, being scared, being powerful, being mad, sad, and I'm missing one. I don't remember which one that one is right now. I missed one. But nevertheless, it's like that's at the core, and then out from there, what are the other words associated with those core words in the center? So Google feelings wheel, and you'll be able to see it in different configurations. But to start to think about, how do I use this language so that I can talk to people about what I'm experiencing? I'm frustrated. And that might be associated with you being mad about something, but you're afraid to use the word mad because of what it does when it is said in your family constellation. It's like, you're not supposed to be mad. What do you have to be mad about? How many people have heard that?
Yeah.
It's like,
Many
you want me to give you something to cry for? So those kinds of reactions to our feelings cause us to shut down. And then we don't have a way to talk about it, and we don't have a way to share it, and we believe it is dangerous territory. So we avoid going to get help, to get over a speed bump. We avoid going to get help that might cause us to be medicated for the things that we have medications for today in a way that allow us to have a balance and a stasis that we can function from. But the reality is we've got to have a language. We've got to have the ability to be heard, to be seen, and to be cared for.
Great, great.
Wait, you mentioned being on medication. Let's say you're suffering from depression on your medication. You're afraid to talk about that because somebody else may think, oh, she's crazy. There's
Yep,
something
that's
wrong
right.
with
Yes.
her.
There's
So
a stigma.
again, you're holding on to this. You're taking antidepressant medication. It's a big secret. You're not going to talk about it.
Yeah, I think the word you said, crazy, it cracks me up, actually. I was thinking about this last week. I said, okay, I'm crazy. I'm crazy for chocolate. I'm crazy for wine. So the word crazy is really not a bad thing, but it's how you view it and how you accept it. And just like you said, we just don't know how to express our feelings. And when you have patients in front of you, and what medical problems do you have? High blood pressure, diabetes. You're taking this medication for depression. You have depression? Well, yeah, I guess they gave it to me. It's like even that people still not,
That's right.
accepting it.
Yeah.
And if you don't accept a problem, you can't solve the problem.
Right.
Sure.
You know,
Interesting. Because in what I practice, one of the things that if you're going to allege in a complaint, in a lawsuit, that there is emotional distress or mental anxiety, then that also leaves the door open for your opponent to, in all candor, to be able to test that theory. You want somebody, you're saying that the at-fault party has caused or has aggravated or exacerbated a condition. We need to figure out what the exacerbation is. That means that they're going to go into your mental health history. So I have to protect that as well before I decide to add that to a complaint. I need to talk with my client. I need to see the medication log. Luckily, I can read that, to be able to quickly look and to see what level of protection I need to give, to see whether or not this has really impacted you, and to what extent is it enough for us to go and open that Pandora's box, or not. It depends on what that box holds. So that's another, the relationship between the doctor and patient, and the relationship between a lawyer and the client is really an important relationship, because it's one of protection and care.
Okay, sounds like there's a lot of stress involved in what we do and how we help folks. But there's a lot more we need to talk about, so we're going to wrap this up. You can join us for section 2, where we'll talk about stress, the role of stress in mental health, and stress management.